First of all, one of the things is to really learn from the many good practices that are out there. This is a key point, I think, where the European Commission can actually help, because we know that there are a lot of good examples on effective pain management and also prevention, I must add. But they don't always, they're not very well known. They don't travel well. And that's an area where I think Europe can help. We have a number of instruments, financial and other instruments that can be used to support that. Secondly, one of our functions is also to match supply and demand. So there is a need for solutions. So we are, on the one hand, inviting public authorities to be clear about what they need, what kind of solutions they are looking for, what they need, and then to try to match that with the offer of tried and tested solutions, which could then be, of course, adapted, but transplanted into different environments. Then we also need to identify the areas where we need to have better data, more information. You cannot have good policy making without good evidence. And a valuable source of information and evidence are patients themselves, particularly on a topic like pain, which is not something that can be measured physically, but has to be, we have to get information about it from the patients and those close to them. So this is something we are also working on as part of our work on looking at patient-reported outcomes and experiences. Patients have a wealth of expertise because they know most very often about their condition. They've been living with it and suffering from it for years, and they know what works and what maybe doesn't work. Now, the other challenge is how to be able to establish communication. So communication, two-way communication, for example, between patients and doctors, say, or between patients and health systems. We are working on initiatives to use digital technology to facilitate this process. So to have, for example, ways and means in which patients can report their experience directly in real time to their doctor or to the health system. That is very valuable, for example, for research purposes, because knowing that information would really add a wealth of evidence that could help improve products, technologies, or even approaches. So this is just some of the work we are doing. To facilitate this, we are really grateful that the various organizations involved in the SIP have come together to create a thematic network in our EU health policy platform, because we really also need to involve as many stakeholders as possible, not just the traditional health stakeholders, but also other stakeholders with an interest in health, employers, insurance companies, trade unions, etc., that also can help, because we know on an issue like pain, it's not just going to be the medical treatment that will solve it. You also need social support, you need psychological support, and you need a lot of other sources of expertise. So we see one of our main roles is actually to act as a catalyst to help bring all these actors together and make sure that this is all done for the benefit of the patient.